Hola, hola, y bienvenidos a Tu Salud, the definitive podcast for Latina health equity, where we talk about all things Latina, health, and policy. Yo soy la doctora Seciah Aquino, Executive Director at the Latino Coalition for a Healthy California. And today I am joined by the most amazing Brenda Solórzano. Brenda is the President and CEO of the California Endowment. Today, we will be talking about the important and sobering moment that we're in, a moment to rebuild from our health and safety net systems to philanthropy through trust-based practices, and being able to do so by channeling our creativity, thinking outside the box, and leading from a place of power. We invite you to grab your cafecito, tune in, and join us for this heartfelt conversation. Y como siempre, a tu salud. Brenda, bienvenida. Thank you so much for joining us today.
Buenas tardes. It's an honor to be with you here today.
Oh, thank you so much. I know we're going through a difficult journey in our country right now, and these conversations now more than ever are so important, not just to support one another, but also plant seeds of hope, right? Now more than ever, we have to do that for each other as a community.
Yeah, I feel like we have to take back the narrative and share the stories of who we are and the importance of the role that we have played in this country and in this state, and not let other folks define us in ways that are not accurate. So I'm glad to be part of this conversation with you.
Thank you so much. And we're excited to get to know you a little bit deeper in these conversations and this cafecito. We are channeling Cristina vibes, want to make sure that, we're getting to the core of who we are as people, right? When we're in work meetings, it's really easy to just focus on the work in front of us. And many times we forget to tell our stories and where we come from and what shaped us to really guide our vision for the work before us. So, to get us started today, we would love to just start with tell us a little bit more about yourself, who you are, where you come from.
Yeah, thank you for that question. I appreciate that we are stepping into a space in today's world of sharing our stories and where we come from. That hasn't always been true in my career. When I first got out of school, it was often jump to the work. What are your
Mhm.
professional degrees? What have you done? Prove yourself. So the opportunity to pause today and share a little bit about myself, I really appreciate. So I'm actually Guatemalteca. I was born in Guatemala,
Chapin?
Chapina. And my parents moved to the United States when I was a baby, and I've always struggled with this because
Mm,
I didn't grow up in Guatemala, but I never felt like I was from here. And so when
mm,
people ask me where are you from or tell us your story, it's a complicated answer for me.
yeah.
Because there are definitely, right, my parents taught us all the Chapin things to eat and to do and to dance,
Mm,
but I never really felt that I was Guatemalan enough. But then I'm also, I grew up in the United States, but I never really felt like I was an American. Um, but in reality, it's both those things together that makes me who I am. So I'm an immigrant kid. I can tell the same story that many of us who are immigrant kids have in terms of having to navigate this world, be the first one in your family to fill in the blank, right? To navigate the world for your parents. My parents didn't speak English when they first got here. And I became a mini adult as a young child because I had to be that outward facing person. And in that, experiencing that, I got to see a lot of injustices and I always kept wondering, like, why does this happen? Why are these things happening to my parents? It seems unfair. And that has shaped a lot of who I am, right? I'm an immigrant. I'm a person that navigates the world for people. And then I'm also, someone who has really benefited from all those things that are safety net programs
mhm.
that have existed in this country. I would not be sitting here as the CEO of the California Endowment if I weren't a Head Start kid, if I wasn't the
Mm,
kid that got my care at a community clinic in the Mission District in San Francisco, if I didn't get a Pell Grant to be able to go to college, if my parents didn't benefit at the times when they were struggling, um, with support from, it used to be called when I was a kid, food stamps. And so all of that has shaped who I am and why I do the kinds of things that I do and the kinds of jobs that I've taken. Um, and I would say that it took me until my 40s to really get connected back into
mm,
my Guatemalanness. Um,
yeah.
and it was because I got an opportunity to go back home. And
Mm,
I don't know if you've ever been to Tikal, but I got to go to Tikal. And I happened to just have this moment of like 3 minutes where I was in the Plaza Mayor, big
huh,
temple, and there was nobody out there, and I was the only one. And I had this moment of like realization that I come from amazing people. The Mayan people were so advanced
yeah.
in math, in science, in medicine, in government, farther advanced than other societies that existed at the time. And that's given me a lot of pride of
Mm.
being Guatemalan and feeling like, this is why I've been able to do the things that I've been able to do in my life.
That's so beautiful. And I don't know if you know this, but we share the Guatemala connection. I was born in Guatemala. I immigrated at the age of 10. And so when I hear you say that, right, La patria que nos vio nacer, it's such a privilege, like you said, to really think about our ancestors and that powerful Mayan culture and the way that our communities are shaped and the culture that regardless of when we immigrated, like you said, right, you came as a baby, but your parents raised you to have those frijolitos and tortillas. Um, right. Like it just creates such a powerful rooting to who we are and how we see the world on a day-to-day basis.
Yeah, but
Yeah.
I'm really glad that my parents did that and that they also taught us to speak in Spanish. So soy
Yes.
completamente bilingüe, aunque crecí
Perfect.
aquí. And that's so important because my mom taught us at a very young age that it didn't matter where we lived, we still were Guatemaltecos at our core. And we had to understand our history, our culture, our language, even though we lived in the United States. And, right now there's sort of this us versus them mentality in terms of immigrants and Americans. When in reality, we're just people that want to celebrate the culture we come from. That's it. Just like, every other culture wants to celebrate. It's why we have, St. Patrick's Day and why we have, all these other holidays. People want to connect back to your homeland. And I think that's part of, who we are as Latinos. I don't know if you watched the Super Bowl with Bad Bunny, but I
Yes.
loved the
Talk
halftime.
about
I loved the
yes.
halftime show because it was unapologetically representing Latino culture in a way that was about life and love and family and joy. And that's so missing in our world today in terms of
Mhm.
how we as Latinos are seen or described. And so it was unapologetically bold and
Lo
Latino. And it was like, yes, I loved it.
Exactly, exactly. It was such a powerful moment for that narrative change that we're talking about, and platforms like these matter so much because of that. We get to tell our stories as we are. Even the beginning, right? When the opening gentleman who is singing says, "Qué bello es ser Latino," right? What a powerful way to celebrate, especially in a time when our communities are intentionally being attacked and pursued.
Yeah, and I feel like it's given us an opportunity to flip the paradigm for ourselves and others. That's a more strength-based narrative, right? There's so many people in the Latino community and the immigrant community broadly that are terrified right now, that are scared, that aren't going to the doctors, aren't going to work, aren't sending their kids to school. And so the opportunity to see, the whole world to see this on stage at the Super Bowl, I think was very inspirational. whether you're a little kid that is trying to wonder, do I belong in this country? Or someone like me that's been around for a long time that just felt really connected back to my roots by seeing.
Yeah. Yeah. And like you mentioned, not just to celebrate, but to share. And I think as Latinos, that's what we do. If we have un poquito de carne asada, we'll call the vecino, make sure other people are fed. That's just part of our culture and how we interact with the world. And, if we're able to center that, sharing, caring, and that love, then how much stronger are we when we're united, regardless of where we come from?
Absolutely. It is so true. And I was on a listserv or a text chat group, and everybody was sharing their pictures of their family watching this. And to see the diversity even in the pictures, right, was a representation of what you just described, which is the togetherness, the familia, the love, and the connection of culture and music was just beautiful.
That's beautiful. Yeah, thanks for sharing that. I wanted to dig a little deeper into what you mentioned, right? The fear of the time and the effect that it's having as a chilling effect. And we've been seeing that grow, right? During the first Trump presidency, we saw it when perhaps it was a narrative paired with some policy changes. We then shifted to COVID-19, and our communities are still recovering from the socioeconomic disparities of COVID-19, long COVID. And now we are being brutally impacted by ICE raids and the second Trump presidency. Can we talk a little bit more about how this chilling effect is not just keeping families and loved ones from these safety net systems that protect our health and well-being, but will have a great impact across not just our lifetimes, but the kids of today will continue to feel that at a very personal level throughout their life journeys.
I am terribly worried about the impact that this moment is going to have on young Latino and Latina in California because it's not only creating this sense of fear, it's
Yeah.
creating a sense of questioning, a sense of do I belong, that fundamentally are going to be destructive to the mental health of these young people. And we all know that our health is impacted by ACEs. And
Mhm.
the moment of fear and trauma that these children and families are living today, we will see in repercussions, as you said, for generations. That we've always had significant health disparities across a number of things. We've been challenged in having access to good quality accessible mental health care in the Latino communities in California. And now you layer this on top of everything, right? That you said, the pandemic, the racial reckoning, and now this current moment. Um, it's it's significant, and I think those of us in the roles that we are need to be thinking about how do we start doing work or continue to do work that helps people navigate this moment. And I'm glad that you're doing this kind of conversation because it's a different way to take back the power, take back the narrative, and maybe create a space in which a young child can maybe have a different experience. But then also thinking about what do we need to do at the policy level, at the systems level, at the political level to be able to address these significant issues that we're going to be, paying the price for a long, long time. And these families and these children for sure are going to be experiencing negative impacts at a bunch of different levels.
Yeah. Yeah. And, like you mentioned, we are so privileged to be in these positions where we're able to bring community front and center, right? To share their expertise, share their priorities, their solutions, and to be able to do so in a state that, where our values still align with protecting the well being and the safety of all Californians, regardless of where we come from. and how much more intentional we need to be, right? As we think about budgets, as we think about legislative decisions to continue to center the most vulnerable as we're facing all these different contexts.
Yeah, and I think we have to take advantage of these positions and the power that we hold to be bold
Mhm.
and unapologetic in demanding that we as a society pay attention to those vulnerable communities and to those kids and to the elderly that are also impacted. Um, we can't sit on the sidelines. We have to, engage and do everything within our power. We need to be using our voice, which can be scary at this time. I'll be honest, right? Like, I think there's a lot of organizations that worry about the target being put on them. Um, but particularly for someone in philanthropy like myself, this is the moment to stand up and call out what is wrong. Call out that this is a continuation of racist practices that have existed in our country from the very beginning. That have been part of the Western world going way, way, way back. It's not anything new. It's just now blatant and being done out in the open. And so there's even more need for us to step up, for us to call it out, and for us to figure out a pathway or motivate, inspire a pathway that takes California in a different direction. And we're going to have a new leader in the governor coming up here. We're going to have a challenging budget year. We all know that. Implementation of HR1 is coming. These are all challenges, and we've got to figure out how we are leaders to minimize the damage, the trauma, and the fear in our communities.
Yeah. I really appreciated what you said in your statement. We will not look away. We will not be silent. Tell us more about that.
Yeah, what they are trying to do is to silence us. They it's almost like, let's do a whole bunch of different stuff to these communities. Let's scare them. Let's move them into submission. Let's make them go away, and then we win. And I believe that there is so much power in the collective we, and that if we stand together as a people, we can be stronger than what they're doing. And it takes some courage, right? It's going to take some courage from all of us that are in leadership positions to stand up and say the things that need to be said, and provide a vision for what a true multiracial democracy where all could thrive could look like. No one's going to do it for us, so we got to do it ourselves. And I feel like in this role at the California Endowment, um, I'm the one that needs to be saying those things and putting those
Mm.
things. It's what motivated me to put out the statement. I was sitting, like many people, just watching the horrendous things that have been happening in these ice raids and kidnapping, and the children that are in these detention centers, the people that are being killed on the streets of American cities. And I was just like, I can't just sit here and not say anything. Like, we have to say something. And to be honest, I'm not a fan of putting out statements, because statements, papel puede aguantar mucho is what my mom always says, right? You can put it
Yeah.
out and, like, who cares? But I felt at that particular moment, someone needed to come out and say what needed to be said. And then we got to follow it up with action, right? I don't want it to be just words. I want the endowment to also say, we're going to be in this. We're going to be front and center. We're going to be in front. I like to say we're going to be in front, behind, and beside the communities and the grantee partners that we have.
Love that. And thank you so much for your leadership because it really does make a difference. Even for us, as nonprofits, being in the weeds, talking to community, hearing them cry on our pláticas. And, we have promotoras across the state who are doing the day to day service of connecting folks to the safety net in a time where many don't know if it's safe to access the safety net. And so to have your support and your leadership and speaking up, it gives us hope as well. So I just want to thank you from the bottom of my heart. And on behalf of all LCHC for your leadership and leading in such a powerful way.
Thank you for that. I really appreciate it. But I think I have to give it right back to you and your colleagues because you are the ones that are doing the hard work on the front lines. You're in those pláticas. You're giving courage to those promotoras. You're advocating for people who don't feel like they have a voice. I can't do my job if you guys aren't doing the very critical, mission critical work that you're doing out there. So
Mhm.
it's a partnership, right? And again, it's why relationships matter, why conversations like this matter, why building trust matters, because we need to all be in it together to be able to achieve that dream of a different California for all communities.
Yeah, I couldn't agree more. Privileged to be in this fight with you.
Feelings
One.
mutual.
Yes, yes, yes. Okay. Well, that takes us to where we're at today. Do you mind sharing what brought you to your role? What was that work journey like? What inspired you to one day go into philanthropy?
So it's a series of kind of forks in the road, to be quite honest with you.
Hmm.
But it starts with, what I shared earlier of being a child of immigrant parents. And from as far back as I can remember, I knew that I wanted to do something to make the world a better place for people like my parents. And that has been my North Star throughout my career. And when I was younger, I thought that the way to do that would be through the law. So I actually went to
Mm.
law school. I took a job at a legal service agency. I represented clients like my parents, and I learned very quickly that I really couldn't fix things for the people that I was representing because the systems were broken. And so that actually made me begin to explore, where do I go from here? Because I can't fix one person at a time. I got to like fix systems and work at a policy level. And that actually led me to apply for a job that I had no reason to get, but somehow I did. And that was working with the Latino Coalition for a Healthy California.
I love it.
And yeah, so that's a personal kind of connection I have with LCHC. And I was actually, Carmela Castellano started this at Public Advocates, but I was employee number one, hired by Carmela for LCHC. And in that role, I got to do everything. I was media person, policy person,
You were
fundraiser,
doing it all.
organizer, like the whole thing, right? It was one of these perfect experiences. And I felt like we did tremendous work in those years. This was around, Prop 187, 219. We were building regional
Yeah.
networks, lots of great things. And I started to realize that, you could actually pass policies doing this kind of work that affect millions of people across the state. And,
Yes.
and that was hugely powerful. So that I did that for a number of years. And then one day someone reached out to me and said, we've been watching you up in Sacramento. We're really impressed. Would you be interested in working for philanthropy? And at the time it had never crossed my mind, right, to work for philanthropy. But that also was simultaneously with a time period in my life where I had been diagnosed with a very advanced cancer and was given pretty poor prognosis and was struggling because I was trying to get access to health insurance, to be honest. And
Yeah.
a lot of the nonprofit organizations that I could go work for didn't have the health insurance that would allow me to see my doctors at the place that I was at. And so my first question to the person that was recruiting me for philanthropy was, do I have health insurance? And so it's kind of ridiculous, right? That I ended up in philanthropy because I was looking for health insurance. And I thought, well, I'll do this job for a period of time because at the time I didn't know how long I was going to be alive. And then someday, I'll be able to go back to the nonprofit um, advocacy world. And I didn't know that that was going to lead to what now has been over 25 years of working in philanthropy. And it has been a really wonderful experience that has allowed me to be in a position of privilege to support important work like the work that LCHC and other amazing nonprofits across the state do. It has allowed me to bring the lived experience into these organizations that historically have not necessarily hired and promoted people that look like me or come from places like me. And it has also allowed me to really take on philanthropy in a different way. I've had a love-hate relationship with the field. There have often been times in my 25-year history in the field that I've wanted to walk away because we are a system. Philanthropy as a whole is a system that also is imperfect and broken. And I have gotten frustrated with it. And so it's led me to try to figure out, how do I actually truly set our community? How do we actually give voice? How do we allow the money of the transfer of money to be more seamless and easier? And
Yeah.
that's been my trajectory in the field of philanthropy, is to break it
Mm-hmm.
in order to
Mm-hmm.
create more access to resources to the
Yeah.
communities that are doing the important work on the ground.
Yeah.
And it hasn't always been easy. But I can tell you that the times that I have been successful in doing that have been the times and places where I've built deeper relationships with the organizations that I have had the honor of supporting, but also created relationships that were beyond the check, that created partnership, support, healing spaces. And I have many grantees that when I came back to California, to take on the TCE job, they're friends. They weren't colleagues
Yeah.
alone. They weren't former grantees. They were friends. And that has been really a phenomenal experience for me.
It's beautiful. And thank you so much for sharing about your experience with health insurance. I'm so happy to see you healthy and here with us. What a blessing. Um, and it reminds me, growing up, I grew up going to mobile clinics, right? That was our access point for my family and I. And I remember the first time I had access to health insurance was in college, and just thinking how free I felt to be able to say, "Oh, I can go to the dentist for the first time in a regular manner. I can just go get a checkup. What is this?" But it is incredible to think that that access to healthcare ends up being such a privilege when it's a right, and we should all have access to it.
Yeah, I think I feel very lucky that I've had an opportunity in my professional life to, for the most part, have coverage. But there are so many people, right, that haven't. And I think in California, a lot of folks have been part of efforts to the point where we got to almost 95% coverage in the state, which is
Yeah.
phenomenal, right? And now we're facing the reality that we're going to probably fall back from that because of, you know, HR1, because of cuts to, safety net programs, because challenges that are being put in front of people to enroll and maintain their enrollment in these programs, that they're going to lose access to such a critical piece of maintaining health, of maintaining a job, of economic security, right? Like when I remember when I was trying to find a job that had health insurance, I was going to be willing to do any job as long as it had health insurance. And I think no one should be put in that position. I know
Yeah.
people that don't have health insurance, have a major chronic illness, or are facing a life-threatening situation and they can't do anything. I know people that have gone into bankruptcy because they had to access care and didn't have health insurance. And not that health insurance is the be all of everything, right? We know that there are lots of factors that drive poor health outcomes across a variety of different communities in our state, but it is such a critical thing that we're going to take steps backwards, I think. And so our jobs are to figure out, how do we prevent that from fully happening.
Yeah, definitely. And a lot of those changes are not just felt individually, right? It'll impact that whole family unit, that community, the state as a whole, and ultimately all of the US.
Yeah, I think this is the part that, the nerdy health policy person in me tries to
Well,
explain to people is, you're saying no to provide care to this population, but you don't understand how integrated all of this system is. And where you cut access, you create opportunities for, you know, challenging health situations to happen from, as you said, from family to neighborhood to city to state to, eventually the whole country. And the whole financing system is interrelated. So you're going to pull out a big chunk of how the healthcare financing system is with these cuts to Medi-Cal, um, that are going to then trickle down to folks that maybe have insurance either privately or through their workspace that are going to have to pay more out of pocket. And so at the end of the day, we're all going to be impacted, regardless of whether you're an immigrant or not.
Yeah, exactly. I'm happy to be in this fight with you, like I said earlier, and I'm happy to share with you. In the legislative cycle this year, we're partnering with Senator Durazo to end this freeze. So we will be putting in legislation to sunset the freeze. And, there are very real budgetary constraints that the state is facing, but we cannot by any means just be comfortable with status quo and the changes that happened last year. We need to keep pushing and we need to keep seeking avenues to restore that service, the powerful work of health for all, and ensuring that it no longer becomes just a talking point, right? And where California once was, but that we continue to fight for that reality today and always.
Yeah, we have a lot of work ahead of us, and I think California has always been on the cutting edge of figuring out creative ways to ensure that as many Californians can continue to have access to care. Um, we had the kids coverage. We've had county health based level services. And I think we have to go back to really thinking outside the box of how are we going to provide care to everybody in the state. And I've also been talking about the systems that we've relied on, whether they are Medi-Cal, Medicare, the safety net programs, the county level programs. They all also have been imperfect, right? It's why we still see significant health disparities in communities. And so we've been trying to fight to protect these imperfect systems. And now we've got an administration that is tearing it all apart and breaking it all down and defunding it all. So the question for me is, how do we think about a builder's moment? This being a builder's moment where we can reimagine what it might look like. And how do we go back to some of our indigenous practices of
Yeah.
maintaining, people's health way before they need the sick care system that we have? How do we think about, different models? I think of community clinics, for example, when they first started, they were volunteer run doctors and nurses and other medical care providers providing healthcare for people in their communities. We saw similar things happen during the pandemic, right? With people relying on people and neighbors relying on neighbors. And I think we're going to have to just kind of reimagine. We're going to have to push our policymakers. We're going to have to push, whoever sits in the governor's seat. But we also have to think creatively and outside of the box at this particular moment if we're going to make sure that everybody does have access to care.
Yeah, I couldn't agree more. And to thinking outside the box, I heard you say you have basically been a Trojan horse inside the philanthropy system and transforming and changing it from within, right? Can you tell us more about, I believe what you call it is trust-based philanthropy? Can you tell
Yeah.
us a little bit more about that?
Yeah, I'm happy to talk about this because I think that it's not very well understood, to be honest with you.
Mhm.
I think it has
Oh,
become a catchphrase. I think every foundation says it's trust based. Who wouldn't, right? Everybody wants to be trust based, but I'd like to unpack it a little bit with you
yeah.
so that I could explain how I think about trust based philanthropy. So trust based philanthropy at its roots is really about building these authentic, transparent, trusting relationships. Something that I would argue doesn't necessarily exist between funder and grantee. There's an inherent power dynamic, and then that's complicated by a whole bunch of other factors in terms of how the system works. So for me, trust based philanthropy is how do you break that power dynamic by building trusting and authentic relationships with nonprofits and communities? And how do we move away from the field of philanthropy's standardized approach, which is rooted, by the way, in the legal field, the academic field, and the banking field, because those were the advisors that created the very first foundations when the Robin Barons were creating, the Rockefellers, the Fords, all of those large foundations. And the field has just reimagined itself, never really asking, is there a better way to do it? Every time a new foundation comes on board, they pick up the phone, call the foundation down the street and say, how do you do it? And then we replicate it. And oftentimes I describe that we're one of the few industries that is continuing to do the work the same way we've been doing it for 50 years. We're not thinking about technology. We're not thinking about different approaches or questioning some of the things that have been put in practice. And that's at the core of what has been driving me in changing philanthropy, is to say, if we're going to break this power dynamic, if we're going to make trusting relationships, then we have to break down the way that we do our work. And we have to ask ourselves, why do we do what we do? Like, for example, I know we at the California Endowment ask everybody to submit a list of their board of directors. Why? Literally, why? I don't understand, like, what would make a difference if we got it or didn't get it. I think I could go on your website and look and see who are your board of directors. I don't need you to send it to me. I think another example was, we in philanthropy ask grantees to submit reports because we want to hold you accountable, or like have a way to tell the story of impact. But my experience is that philanthropy doesn't really do a whole lot with those grantee reports, I'll say. And so the question has always been for me, why are we requiring this if we're not really using it? Another example is, we do a lot of this quote unquote due diligence. And I can tell you that as someone that's been in the field at a number of different foundations, I rarely engage in a long-term conversation and a back and forth with an organization that I don't think is going to get money from this foundation. I will usually, kind of tell them, you're not a fit, and move on. It's only those people that I feel I'm going to get through the game that I'm going to take you on this journey. And then you and I are going to play a game. I remember writing grants for the Latino Coalition, where I was like, okay, I'm reading the RFP. I'm going to write it the way that they're going to think this is a great fit. And then we would get the money and we would go do what we really needed to do. And then when it came time to report, we would write the report that we thought the foundation wanted to hear. Wasn't always completely reflective of what we were actually doing. And we were piecemealing, right? Lots of different grants in order to. So for me, it's like, why are we doing this? What's the value add? So in trust-based philanthropy, it's you're really thinking about building trusting relationships. You're really trying to break down the bureaucracy. You're really trying to ask, why are we asking for all these things that keep people from focusing on mission critical work and instead focus on us, right? And our requirements. If I can share just one little example of a thing that I did at the previous foundation I was at that sort of gets at this. There are a lot of small organizations out there that have a really hard time competing for resources from large foundations. Because it's hard. You need to have a grant writer. You need to, do all this work. You need to have all these systems. You need to prove yourself, right? And it takes months and months and months to get a grant, even if you are that large organization with all those resources. Yeah. And I kept asking myself, banks move money so quickly relative to philanthropy. Why couldn't we do that? And the example I kept using was, you could go to a department store and you'll get asked by the clerk, do you want to apply for a credit card? And you enter in like a few pieces of information to this machine. And then almost instantaneously, it tells you whether or not you're credit worthy because of a FICO score, right? And then you got $1,000 to buy all the jeans you want at the Gap or wherever it is you shop. I'm like, why can't we do that? Well, we actually did that in Montana. We created a FICO-like score for our organizations. If you were in our service region, if you were mission aligned, if you have been operating 3 years or more, and if you were a tax eligible organization, all things we could check by simply going to the GuideStar 990 information, then we should fund you. And that's what we did. We automated it, and everybody who met that criteria by checking against the system, we would give a grant to. And anybody who didn't meet any of those criteria, we wouldn't. And what would it require of our grantee partners? Putting in your contact info and your tax ID. That's it. And we could actually, because it was automated, approve a grant within 24 hours and get a check
That's
out within 2 days,
transformational.
right? That and the grants were general operating grants. And so that began to create a very different kind of relationship with the organizations that we were working with. They felt trusted. They felt seen. They felt believed in, which then opened up the opportunity for us to have a different kind of conversation that wasn't about funding, but like, how can we help you continue to move the needle on behalf of the communities that you're advocating for? Which then led to more funding. I mean, it was beautiful, but it's just one example of how breaking the system and changing the paradigm and giving the power back to the organizations to focus on the work and not focus on us can be radically transformative for organizations. Now, imagine if we could do that across the board in philanthropy.
Yeah. Wow. That's transformational. Absolutely. And like you shared, having to have the resources internally, even finding a grant writer is extremely hard. There's very few people who are trained in it. And if not, we have to do our own hiring in-house. And then folks leave 1 or 2 years later because grant writers are so needed everywhere.
Right, right.
So that kind of system, that's transformational. Thank you for thinking of that.
Yeah. So that's just one example. And I'm always like telling people, if you have other ideas that you think, why doesn't philanthropy do this or that? Like I'm all ears. I feel like part of my job is to reimagine and rethink how we can be a better partner to organizations across the state.
Yeah. And I love how you really engage with creativity because there are so many other systems, like you said, banks, right? There are these other systems that work a lot more efficiently than many of ours in the public health and healthcare delivery system that we can learn from. And even international examples that we can learn from, right? And then take the pieces that can adapt to our work and bring it back to improve and reimagine what and how we do it.
Yeah. And I think that's true for the moment we were talking about of this moment of reimagining the safety net, reimagining access to care, reimagining how people get mental health services. We've got to be that creative thinker. We've got to be thinking outside the box to figure out how do we do things that people need to have access to, but maybe not in the same old way that we've always done it.
Yeah. No, 100%. We'll definitely tap you. We are currently working on a Latina and Indigenous health equity agenda, actually through the amazing support that TCE provided through the social bonds work. And we really engage with the thinking, what does a health reform look like for Latina and Indigenous communities? And we actually created, because of that support as well, our regional power hubs. So now we have about 16 Latina and Indigenous led and serving organizations across California. And we're coming together to create this agenda that will create a blueprint for the work that we're doing in partnership with one another, but also as a blueprint for the state, both administrative, legislative priorities, and ideally guide it from that community perspective.
Yeah, I love to hear that. That gives me so much hope, right? That you and your colleagues have been able to pull something like that together. And, I hope you're going to be sharing it with our new governor, whoever that may be. Um, yeah, and other policymakers, right? Yeah, I think that's the other piece is we sometimes think that it starts up at the top and we don't realize that there are a whole bunch of other people that play roles in the systems that we need to be working with, whether that is, government agencies thinking about, federal, state, local, municipal levels of change, because it's all going to flow down. And so we have to be thinking about how we're advocating and sharing the things like you described. And I love that it's rooted in indigenous approaches and culture. Indigenous communities have been around for thousands and thousands of years and survived just fine and dandy without, the modern world or with America, the United States. And so I deeply believe that there's deep wisdom there that we need to go back and tap into and, not to come full circle, but like this is the inspiration that we can get from our Mayan ancestors and other indigenous cultures, I think could be radically transformative for us.
Couldn't agree more. And I think we've talked about it a little bit, but putting this question on the table for us, how do we finally achieve health equity for Latina and Indigenous communities in California? What's left to do?
Unfortunately, I think that there's a lot of work to do because
Mm,
we are going backwards under the current administration. So I think that yeah, you're doing some of the things that I think LCHC has already started to do, right? Tapping the indigenous wisdom to reimagine what health and well-being look like. We you talk about how do we get to health equity. That's not necessarily rooted in health care. It's rooted in the idea of um, how do we make sure that people have a roof over their head, educational opportunities, food on the table, access to childcare, all the things that um, will actually keep you from being healthy or not. And we need to be thinking holistically about that. We need to be thinking about how do we continue to support the building of power among our communities. And that's everyone from the young kids that may not see themselves as being in a powerful position all the way to our abuelitas and how they can have a voice in determining the future of California. And in that power building, it's the organizing, it's the mobilizing, it's the, getting people registered to vote, getting people to become citizens, turning out the vote, right? And educating folks. The work in healthcare can be very wonky and nerdy, and how do we bring it down to a level that makes it easier for your everyday person, in particularly your Latino community, being able to engage and understand. And this is where the power of the promotoras really lie. They are such a powerful force. I love
yeah,
them, and I think that they are the key to like how do we work with them to really, build the power of the people that they work with, the communities that they are in. I also think that we need to be thinking about solidarity, right? We can't go it alone. The anti-blackness, the anti-indigenous, the anti-immigrant, they're all rooted, as I mentioned, in sort of these white supremacist, racist approaches that have existed in our country. And the only way we're gonna be able to move that forward is to really start thinking about how do we work in solidarity, and how do we build, an agenda that addresses the intersectional needs of all of those communities. I think that's really important. And then the other thing I'll throw into the mix is, right now we're seeing clearly an authoritarian government, clearly attacks on civil society, and we can't just stick our heads in the ground and pretend that we don't have a role, we don't have something to say. I never thought before I accepted this job that we would be working in the civil society space as a health foundation. The reality is we can't ignore the fact that free public media, unbiased media is being erased. We can't ignore the fact that there are steps that are being taken, actions that are being taken that are going to take away the right to vote. We can't ignore the fact that our civil rights are being violated. And, right now the courts are barely protecting us,
yeah,
and we could end up in a situation that is, I mean, I think we're almost there already, and it could get so much worse if we don't pay attention to this. So I think those of us who have worked in the healthcare space really need to broaden our thinking again. Social determinants of health, racial justice, and then civil society.
yeah. I couldn't agree more. I think it's such an interesting nexus, right, that we find ourselves in. Our communities are on survival mode. Basically, can I afford to go outside and walk the dog, or will I get kidnapped and my kids won't have food on the table tonight? Can I go to this healthcare appointment, or can I wait a little bit until it hurts a little bit more because who knows if ICE will show up at the clinic? And pairing that with what you're sharing, right? While the Latino community, Latino and Indigenous community is being targeted, now all communities of color and even allies are being bundled into those attacks. And like you said, this is a white supremacist agenda that we are seeing the effects of in very real time. So, how do we continue to unify our efforts, support one another, no longer, take this narrative of one versus the other, or, does this group get the funding or does this other group? No, how do we share resources? How do we continue to push forward so that we can protect one another?
I 100% agree that that is sort of the direction that we need to go. And I understand the need for, ethnic specific organizations to exist and to advocate. So I'm not saying we don't need that. I'm just saying like we've got to all come together and really stand united in support of, thinking about a different California, a different country. I do believe there's more of us, and I do believe that the moral courage and the moral values that we as humans have will help
Yeah.
us turn there. I mean, I'm starting to see some of it. You still are. We're up against a big hill, and we're pushing the boulder up the hill. But um, I feel like people are starting to begin to question the humanity of what our government is doing
Yeah.
in these cities, in these communities, and people, including allies, are putting their lives on the line,
Hmm.
pushing back. He's super inspired by the citizenry in Minneapolis and what they have been doing, and they're a model for us, right? For whatever city is next on the target list, they're a model for us of everybody coming together as a community, as a people, united as one. Pushing back, and we gotta do that work. And those of us who are in these kinds of positions that I happen to find myself in need to be leading the way, and providing cover, right, for those who can't be out on the street, doing what we need to do and saying what we need to say.
Yeah. And to that people power, right? How do we protect our people? Something that we're finding even within our own staff, right? We're all Latine. We're all facing this, of course, as colleagues and in the systems that we serve, but we're also facing it at a very personal level. We have mixed status households represented. We have folks who are documented, who may be undocumented, right? So how do we continue to protect ourselves and our teams from burning out in such a heavy season for this work?
I think we have to pay attention to it. We can't disregard it. It is a very real thing, right? Like all of us are being impacted. If you don't look American in terms of what they perceive, you are now on the defensive and you are scared. And some people have more real, fear than others simply because of their status. And so we have to pay attention to it. We have to create spaces in which we are tending to the needs, the emotions, the feelings that are happening in our employees and in our partners. We need to really be thinking about where do we have healing spaces?
Yeah.
How do we bring that into our workplace? And I also think we need to think about how do we reframe this from they're doing this to us taking back the narrative and
Yes.
and spinning it in the way that Bad Bunny did at the Super Bowl. That it is about joy, it is about familia, it is about culture, it is about music, and how do we reconnect to that, and don't just become the pawn, the victim of this administration. And I know that's harder to do than it is for me to say it, but I think anybody who's in a leadership position really needs to pay attention to this right now, really needs to be taking actions. Um, and then beginning to document how this is going to impact
Mhm, mhm.
future healthcare expenses, healthcare
Yeah.
outcomes, um, uh, what are we going to have to do to crawl back out of this? I think there's a tremendous need to be able to begin to capture and tell that story, because I want to believe that we're going to get out of this at some point, and we're gonna be in rebuild mode. But the only way we can rebuild towards something better is to be able to tell the impact of what was done in
Hmm.
this time period.
Yeah. And the workforce and GDP, I mean, the economy already is suffering because of these attacks. So it behooves the government to protect all people, regardless of where they come from, because we all contribute. If our lives and our dignity as human beings are not respected, then at least their bottom line should tell a story. I wish both were, respected and pursued, but if they're not, then how do we tell that economic story and say you're actually hurting yourself by going after innocent people?
Yeah. And it kind of sucks, I think, that you have to turn back to capitalist economy arguments. But
Really
sometimes
does.
that's the only way that certain people will hear it. And so I think we have to think about that. And I think we also have to think about, as we said, different ways of doing things that maybe are not things we've tried, or that our ancestors tried and we walked away from, or forgot about.
Yeah. Yeah, and to your point about pivoting, right? So how do we now focus? Okay, we have this opportunity now to rebuild a system that wasn't made by us or for us, but now we have this opportunity to rebuild it for ourselves. So what does this new healthcare system look like if we're actually centering lived experience and communities of color and disenfranchised communities to inform what we actually need?
Yeah, I think it's going to look radically different than what we've had.
Yeah. Definitely. Okay, so let's shake this off. We have a heavy topic
Yes.
before us, but to end on a good note, are there any fun mental health practices that you have? I know you lived in Montana. I love Glacier National Park. It's so beautiful. Any hiking that you do? Tell us a little bit about that.
Yeah, in my age, have started to realize that I need to pay more attention to my own health and well-being. That whole put your oxygen mask on first. I wasn't always good at that, but I'm realizing that if I need to be present for, my mom who lives with me, for my kids who are away at college, but still, they still call me when they need me. uh, my staff at TCE, our grantees at TCE, the community, my friends, and my partner, then I've got to take care of myself. And so I've started to do a couple of things in the last, probably 5 or 6 years that are about me. And I don't feel
Mhm.
bad about saying that anymore, because I
Love
used to,
it.
right? I used to be like, I can't be about me. Swim. um, I used to be a runner, and then I've gone to an age where, like, the running is a killer on my back and knees, so I decided to swim. So swimming every day, is really
Absolutely.
important. I became a huge lover of the outdoors. I was a city kid, and my parents never had money to send us to ski or camp or any of these things that, were outside the realm of possibilities. And then, having lived in Montana for almost 8 years, I learned to appreciate all that. I learned how to ski. I learned how to white water raft.
Really?
Yeah, I did. We went camping in all the different amazing places there. We did hiking. I did snowshoeing. I mean, you name it, I did it. And that's
Wow.
that's actually part of the reason why, um, I think I felt so connected to being in Montana, because it grounded me to the land in a way that I never had been grounded.
Wow.
And I think it brought me back to my indigenous roots. Like, I would love being connected to the ground, and I didn't understand why. And my sister's like, "It's because you're Mayan, Brenda." And so I now try to find time to do that, whether it's a walk on the beach, a hike up in the mountains. I still haven't figured out where to camp in Southern California, so I need to kind of figure that piece out. And then the other thing is, I make time to sleep. Um, I think
Of
I've
course.
realized that, I can't stay up late if I need to get up early, and if I'm not well rested. I can't function. And so I'm trying to be better about monitoring my sleep and making sure I'm getting, 7 to 8 hours
Yeah.
to really rest. And then the last thing I'll say is, esta maquinita
Yeah.
is not good for your health and well-being. So put it away when you can. Put it away. Don't go to
Yeah.
sleep with it. Don't wake up with it. And I think drawing those lines are really important. The last thing I'll share is I'm not good about taking vacations because I've always had
Um,
to work and I feel like it's never a good time for a vacation. But this year, for the very first time, I have 3 trips planned. 1, because my daughter's graduating college.
Oh,
2,
congratulations.
because I miss being in the outdoors, and I'm gonna do a whole 4th of July trip to Montana and visit, Yellowstone. And
I
3,
love
my son's gonna be studying abroad in Europe, and I'm like, "Well, heck, if he's gonna be there, I'm gonna, like, make a 2-week trip out of it, go visit him, and
it.
then take some time off."
Oh, that sounds amazing. I'm so excited for you. That's the best because this is a long journey. We need to be well to be able to take care of others from our immediate teams, right? To the community that we're trying to protect and the whole state that we're trying to better. So I'm so happy to hear that. And I hear you on the phone piece. And that's why I love swimming as well, because for that time, right? You cannot focus on anything else. You have to stay alive. So you have to breathe and you have to stay focused in the water, just in being present.
Yes, absolutely. I that's one of the reasons I love to swim, is that it's just me, and breathing.
Yeah. Yeah. That's beautiful. Well, with that, just being and breathing, we just want to thank you so much for your time today. This beautiful conversation, again, rooted in hope, rooted in that shared love for family, for our culture, for our people, and what we can do together to really better our communities, the state, and this country as a whole. So, thank you so much for who you are and everything that you do. We appreciate you.
Thank you. The feeling is mutual. I have really appreciated spending this time with you and talking, and look forward to continued partnership with you all and the team at LCHC.
Muchísimas gracias.
De nada, cuídate mucho.
Igualmente. Bye bye.